Hi, Brianna. My name is Jamie, and I'm a nursing student from Cal State San Marcos. How are you today?
Good, how are you doing?
Good, thank you. Now, the nurse let me know that you'll be going home soon. Is that correct?
Yes.
Yeah. I made a brochure for you on how you can manage your coronary heart disease from home. I saw on your chart that you do have hyperlipidemia, hypertension, and you have previously suffered from a stroke, and you're now dealing with paralysis on your left side.
Yeah.
Yeah. So all of these are actually related to coronary heart disease. And this brochure here is going to give you information on how you can manage it, okay? Now, coronary heart disease is known as cardiovascular disease, which is caused by plaque buildup in the heart's blood vessels. This buildup causes blockage and does not allow blood and oxygen to flow and supply the heart. So risk factors associated with coronary heart disease are actually high blood pressure and high cholesterol, which you have. Now, we can help you manage this disease as well as those risk factors by focusing on incorporating exercise and a healthy diet, because lack of exercise and high fat foods actually are risk factors for this condition. Now, that's going to be our focus in this brochure: eating a healthy diet and exercising. It's recommended you incorporate 4.5 or more cups of fruit and vegetables daily, 2 or more 3.5-ounce servings of fish per week, preferably oily fish. You want to focus on omega-3 fatty acids, 3 or more 1-ounce servings of whole grains, less than 1,500 milligrams of sodium per day, and less than 36 ounces of sugar. You want to limit high-fat foods, sugary drinks and foods, as well as salt intake. For exercise, we want to get you to at least 2.5 hours of moderate intensity exercise each week. That's your long-term goal. But to start off, we want you to start with 30 minutes of physical exercise at least 3 times a week. And you should be able to talk during moderate exercise. So that's something to keep in mind. We want you to incorporate strength exercises at least 2 times a week, and do some resistance training and balancing coordination to help with your left-sided paralysis. Exercise in groups to stay motivated, and remember to stay hydrated. Now, on the back here, I provided a visual for you. That way you can know roughly what serving portions look like. So a small apple is about a cup, and that's about the size of a baseball. Half a cup of fruit juice is the equivalent of a kid's juice box. Now, a baseball is also about the equivalent of a cup of yogurt, and a slice of bread is an ounce. So I want you to keep that in mind. This diagram is really helpful. If you do have any other questions, go on choosemyplate.gov, and that'll give you more information. I do want you to keep a food and exercise journal. I want you to record daily. I want you to record your food type, serving size, salt, sugar, and fat contents for breakfast, lunch, and dinner. And for exercise, I want you to record the exercise type as well as the exercise duration. Now, you can do that by just using a simple journal, or you can even go online and use the Super Tracker feature on choosemyplate.gov. Additionally, I have included information about the American Heart Association website, which is this one here, www.heart.org. And just remember, in general, we want you to focus on fruits and vegetables, fish, lean meats. We want you to decrease high-fat foods, sugar content, and salt. I'm not saying don't eat salt, don't eat sugar, and just want you to remember moderation is key. You can have a little bit of everything, just moderate portion sizes, especially when going out with friends and family. You can have a little bit of everything. Just, keep this in mind as you're making healthy food option choices. And did you have any other questions for me?
No.
No? Feel free to also contact the facility, the nurse, or myself even, and we'd be more than happy to help you. Okay, Brianna?
Okay.
All right, so hopefully we'll see you back within a month or so. That way we can evaluate your progression of your diet and exercise routine, okay?
Okay.
This is for you to keep. Thank you so much.
Thank you.
Thank you.